many women even cannot define what is happening in their body, and many of them are coming to the general practitioners, not to the gynecologists, because the menstruation is normal, they have their contraceptives, so they do not need to go, but they are coming to the doctor because they feel something is bad. The sleep is not as it was, the mood is changing. If they are open enough, they can speak even about the libido, that the sex life is a little bit different, so they feel that something is changing. Women are coming mainly because of two issues. The first is they see that the menstruation becomes strange. Either they have longer period between one bleeding and the other, or they have some bleeding that are too often, every 2 weeks, every 3 weeks, and then they come to the doctor, and then when the doctor makes a blood test, he finds that she is in what we call the perimenopause. It's the time between the normal fertile age and the menopause. This is the perimenopause. The other group comes because the menstruation is normal, but they feel that something is happening in the body. So if I summarize, those women are coming because of the beginning of symptoms, and there is, let's say, 10 to 20% are coming pure because of hot flushes, because the hot flushes are full-blown when the estrogen level become at the end to the lower level, then the hot flushes are really severe. Until today, all the treatments were beneficial but had significant side effects, as you mentioned, breast cancer issues, Alzheimer issues, and also clotting problems. Today we have Femarelle, which is a novel treatment, a novel SERM, a selective estrogen receptor modulator that can work on the estrogen receptors on the brain and in the bones, but at the same time they are not working on these undesired sites. And this was found in several clinical and preclinical studies, and in these studies that will clearly show that Femarelle did not activate the estrogen receptors in these undesired organs like the breast and the uterus. If you ask every woman that is used to get up 4 or 5 times a night, even not as Dr. Nachtigal in her presentation told us that there are women with severe hot flushes and severe symptoms, even if they are mild, and they get used to it. If you ask them, I have now a safe solution, that even those mild symptoms will go away, she will say, excellent. I see it in my patients, that when I discuss with them and I tell them, try Femarelle for 1 month, and they are coming back and you don't believe, the first thing they say, doctor, my sex life is like when I was 30. And they get used to it, as you say, the sky is cloudy and they live with it. But suddenly when they see that it can be different, they continue, they get commitment to Femarelle. Once you define that the woman is menopausal according to the anamnesis and according to the blood test, you discuss with her the options of estrogen treatment and of other treatments, including Femarelle. That the main issue of Femarelle is that it have a strong scientific backup regarding the safety and the efficacy. This woman that is starting the perimenopause, starting with the complaints, you do not need to wait until she's awaking 10 times a night. It's enough that she's awake 3 times, and then you can start the treatment and go onward.